Having personally experienced the devastation of a family member with bipolar disorder and the resulting fallout from such a diagnosis, I feel the importance of helping both persons with bipolar disorder and their families discover the best ways of coping with this illness. The stigma associated with bipolar diagnosis often leaves the individual feeling isolated and fearful of the disclosure of their diagnosis to family members, friends, co-workers, and employers. Helping individuals overcome this fear and become willing advocates for themselves and others are two important goals of counseling. Bipolar disorder affects nearly 6 million adult Americans. Equal numbers of men and women develop this illness, and it is found among all ages, races, ethnic groups, and social classes. The illness tends to run in families and appears to have a genetic link. Bipolar disorder is the 6th leading cause of disability in the world and is a major cause of suicide. What is bipolar disorder? Bipolar disorder is a treatable medical condition marked by extreme changes in mood, thought, energy, and behavior. It is not a character flaw or a sign of personal weakness. Bipolar disorder is also known as manic depression because a person's mood can alternate between the poles of manic highs and depressive lows. What are the symptoms of bipolar disorder? Bipolar disorder differs significantly from major depression, although the symptoms for the depression phase of the illness are similar. Most people who have bipolar disorder talk about experiencing the highs and the lows. These changes in mood can be severe, ranging from extreme energy to despair. The intensity and length of these mood swings and the way they disrupt normal life activities distinguish bipolar mood episodes from ordinary mood changes. While experiencing the highs of bipolar or mania, a person may feel it impossible to maintain their focus on tasks for any extended period of time. At the same time, this person might stay awake for days at a time and display high energy levels while appearing fully functional. This decreased need for sleep is a hallmark of a manic episode. Expressions of grandiosity, exaggerated optimism, and self-confidence may accompany mania. Distractibility is often accompanied by racing thoughts and speech. Multitasking, excelling in sales, or taking on many projects are seen by our society as functional and useful. Bipolar disorder may manifest itself when these increased goal-directed activities are expressed to excess. These may be characterized socially by increased socializing, sexually by increased libido, occupationally by increased productivity, and academically by studying more than usual. In all cases, usual levels of activity need to be compared to those of the person in a normal state. While these goal-directed activities might impact one's life in a positive manner, the impulsiveness expressed in pleasure-seeking activities that do not display good judgment often impact one's life negatively. Such behaviors as sexual indiscretions, reckless driving, spending sprees, and sudden traveling may be indicators of mania. While some people describe their mania as euphoric and energetic, others are soon seen as being irritable and quick to anger. In the most severe cases of mania, one's perception of people and events become distorted, disoriented, and confused, with their not being able to distinguish the reality of their world. A person is least likely to seek treatment during a manic episode due to poor insight regarding their mood and behavior. The lows of bipolar are easily recognized as the symptoms of major depression, which may include prolonged sadness, loss of interest in one's daily activities and interest, social withdrawal, unexplained crying spells, pessimism, irritability, anger, worry, agitation, anxiety, and feelings of guilt and worthlessness. The physiological symptoms may include significant increase or decrease in appetite and sleep, loss of energy, persistent lethargy, and unexplained aches and pains. An inability to concentrate or make decisions may accompany a depressed state. It is during these low times that one might experiencing recurring thoughts of death and suicide. A psychiatrist or counselor must help determine whether one is suffering with a unipolar, major depression, or a bipolar depression. Bipolar disorder is confirmed when a person has also exhibited manic or hypomanic symptoms. Hypomania is a lesser form of mania. The treatments for these two types of depression differ, and bipolar disorder may be triggered by the use of antidepressants used to treat clinical depression. As you can see, the diagnosis of bipolar disorder involves many complicated symptoms, and there are new breakthroughs in treatment. It is important to seek the help of a psychiatrist or counselor trained in the management and treatment of bipolar disorder whenever possible to prevent delay in diagnosis and treatment. Bipolar disorder is a real physical illness requiring treatment with mood-stabilizing medications prescribed by a psychiatrist. A primary care physician or therapist might be the first health care professional to recognize the illness, but a specialist is required for accurately diagnosing and treating the chemical imbalance occurring in the brain. When left untreated, the long-term outcome for bipolar disorder can be less optimistic. The nature of bipolar disorder is one of ups and downs. Treatments for bipolar can also have ups and downs. Wellness and recovery most likely will not occur overnight. Relief from symptoms is only the first step. Wellness is a return to a life that you care about. Recovery happens when your illness stops getting in the way of your life. The support of a compassionate counselor who educates and helps one establish and maintain a healthy lifestyle and recognize their life stressors and triggers is an important part of treatment. Educating oneself, family members, and friends is vital to the recovery of individuals with bipolar disorder. Seeking support with such groups as the Depression and Bipolar Support Alliance helps overcome the stigma associated with bipolar disorder. With the help of supportive family and community, one can learn the skills necessary to take charge of their illness and live a fulfilling life. As members of a community of faith, it is important for us to reach out to those affected by all mood disorders. Recognizing symptoms described here might help you better understand the person who struggles with bipolar disorder. I encourage you to become more sensitive to those persons and become advocates for them in the church, workplace, and the community at large. Be joyful in hope, patient in affliction, faithful in prayer. Share with God's people who are in need.